retained reflexes is such like a buzzword and a trendy word right now out there. But this is one that I truly think has some research behind it and can really get behind. There's some fads that in the healthcare world we need to say goodbye to, and some that I think really need to become a part of our everyday life. And working on retained reflexes and pediatric therapy is something we're very passionate about here at Compleo. So Kendra is our PT/OT team lead. She has her doctor of physical therapy just like me, but also has a extra certification in retained reflexes. I'm Kelsey, founder of Compleo. We're in one of our favorite rooms, our baby room. Both of us love working with babies. We could hang out with babies all day long. So why don't you start by telling everyone a little bit about just kind of what is a retained reflex? Like a lot of people like to cling onto that, but don't really know what it is. So
yeah. So like she said, I'm Kendra, and the certification that I have is I am a certified primitive reflex integration specialist, clinical specialist. And so retained reflexes, there are reflexes that we are all born with. Everybody has them. And then as you develop, they are supposed to go away. One of the biggest ones that a lot of people are familiar with are the Moro reflex, which is like your startle reflex. And then the other big one that people really kind of can see is it's called our ATNR. So it's that fence pose. So it's when your baby is little and they turn their head one way and their arms automatically go like this.
Yeah. They go into the Heisman when they...
So that is one that we all have. And then it's supposed to go away. And they're all coordinated with developmental milestones. So if you think about it, a kiddo, when they turn their head this way, if their arms automatically go like this and they can't get out of it, they're not going to be able to roll. So you see that reflex start to go away around 4 to 6 months, which is when they start rolling. So that when they turn their head, their arms and their trunk can roll over. So we're born with them. They have a reason. But if they persist and they stay, we do see that we have some things in development that don't happen. So all of these reflexes start out being based from the brainstem. So your brainstem is what's going to fire first when you have a response. So that's your fight or flight response. Like all of those things.
Hunger, it's our very basic needs.
Yes.
To stay alive.
Yeah, that's coming from our brainstem. So when these reflexes get integrated, they move into our cortex in our brain. So if they don't get integrated, that's going to be your child's first response. So there's a response that's supposed to go away to help us crawl. So if that doesn't go away, you may see some delays in crawling and things like that. And as they get older, some of the behaviors just get a little bit bigger. A lot of them can mimic ADHD. There is a specific primitive reflex that is linked to bedwetting if it is not integrated.
Which reflex is the one that's linked to?
That's the spinal gland. So there's handwriting issues, there's coordination issues, there's balance issues, there's focus issues. All of these issues can be because we may have a retained reflex. Yeah. So the goal with primitive reflex training is that we're going to do specific exercises that move within these patterns that tells your brain, hey, this reflex needs to go into our cortex. Think about it like a filing system. You still have a startle reflex, right? If something scares you, you will startle. But the startle is not your first response to anything that happens. And that is because that startle reflex has gone into that filing system in your cortex. And when it needs it, it gets pulled out. It's not your first response.
So when you're kind of working on this reflex integration, I know I've worked on it on some kids, and one of the stories I think that is like the most clear example is an elementary kid who kept falling out of their chair because they had that ATNR. So every time the teacher said their name, they would look and do this, and then it would pull them out of their chair. And so as far as I know, the work we did has lasted because they haven't come back. But kind of what does the research show if you work with the reflex integration specialist, once that work happens, do they ever reemerge and have to revisit? Or as long as there's like no brain injury or nothing catastrophic, is that kind of filed away forever and we don't have to revisit that again?
Yeah. Typically, that's what happens. Once it's integrated, it's integrated. And if, like you said, we actually can see some retained reflexes in people who have pain or have a traumatic injury or a brain injury, things like that. So you actually can see retained reflexes in adults.
If they've had something big happen.
Yeah. Exactly. So we do see some retained reflexes with kiddos with trauma. So there is a chance that it could reemerge if there was not necessarily a brain injury, but a traumatic life event. But once they kind of know what to do, you go back to this exercise once or twice a day for 4 to 6 weeks. and you get back on track.
So is that, because I've loved this, but I don't have the certification. So you've done more work with it than I have. So with the kids that you're working with, is that about the amount of time, like 4 to 6 weeks, if there's no other, traumatic brain injury or really big thing going on, is that about how long it takes for it to integrate? Which is really not that long.
No, it's really not that long. The movements are slow and controlled. They should take you 1 to 2 minutes every day to do these exercises once a day, 4 to 6 weeks. Kind of depending on the reflex. We've seen a lot of progress with these really getting integrated fairly quickly.
So for the parents out there, because so many pediatricians say like, well, let's just wait and see, or, they just might not be an athlete. That's okay. But really it can be these retained reflexes. So for the parents who are watching, what are some big things that should cue them to like, oh, maybe I should go get a screen from a developmental PT or OT?
Yeah, I think decreased coordination, trouble with handwriting, if we're still having bedwetting, trouble focusing. I mean, from my standpoint, I would rather get it checked out. And if it's reflexes, it's 4 to 6 weeks before we move into pursuing any sort of ADHD diagnosis, things like this. Like, let's see what work we can do here before we move towards something else, because they do mimic each other quite a bit.
And there's lots of things that can mimic ADHD diagnosis. So I definitely always recommend parents kind of work through a hierarchy of conservative approaches. And then if there's nothing wrong if you have an ADHD diagnosis, but if it is the retained reflexes, the typical medications for ADHD might not help.
Yeah, exactly.
So we just want to make sure we're getting the right intervention for the right symptoms.
Yeah.
So if you live close to Central Texas, we're happy to help you here. But for people who are elsewhere, what do you recommend looking for if like, okay, my child has this bedwetting or isn't crawling? What are the things? So definitely, I always say looking for PTs and OTs, places that maybe do a little bit longer sessions, places that maybe don't use as many assistants, but kind of what else would you recommend looking for if they're interviewing therapists?
Yeah, I would be asking like, can you check their primitive reflexes? It is something we are all taught in school, and I think it is coming up more now that it is becoming more of a standard check within evaluations. But if you are noticing some of these concerns and you're going to a PT evaluation, I would ask for primitive reflexes to be checked.
Frequent falls is another one. That we mentioned balance, but I definitely think frequent falls, bedwetting, really any challenges like motor-wise, gross motor, fine motor, we should include that check.
Yeah.
Anything else you would have to say about like?
I mean, I think the biggest thing I've seen it with just kiddos with decreased coordination, but like pain and things too. So I think it's a great avenue, and I've seen a lot of great success, even as far down as babies. Working through that startle reflex allows them to get into tummy time more. I mean, I think there's so many benefits on so many different levels, and so I've seen great benefits through reflex integration.
Perfect. Thanks.
Yeah.
So make sure to comment below if you have any questions. Give us a like and a follow for more information about how to best take care of your kiddos.